My name is Heather Seba. I've been here at Bryan for 9 years. I'm the supply chain director now. And I have a husband, Justin, and 3 kids, Claire, Logan, and Stella. My daughter, Claire, she was 13 at the time, and she's had a tree nut allergy that we've known about for about 8 years. And she had a protein bar that she didn't realize had cashews in it. And took one bite of it and could immediately tell that she was having a reaction. While we tried to see what we could do at home, it was pretty apparent that we were going to have to get some outside help pretty quick. So we got her in the car and got her to Bryan as quickly as we possibly could. As soon as we got into Bryan, I just knew that the team here would take care of her. You could see that they were just so calm and coordinating in the back to get people out of the triage room and find a space for Claire to be seen right away. To have them be so calm and professional in that moment makes you feel calmer and makes you feel more confident in what's going to happen next. The ED was so full, there were patients lining the hallways, and the staff was just doing their best. When we got to a room, they were all working together to clean the room as quickly as possible and strip the bed, clean the bed, remake the bed, and just get her on the edge of the bed. Alicia was the nurse, and Cade was another nurse that came in, and Dr. Bernhardson. There were some patient care techs and other people that were definitely swirling in and out of the room, and I didn't catch everyone's name, but they got her an epi shot, and she started to feel better pretty quickly. But Alicia was the nurse that was in there the most with us and just kept checking on Claire and asking her if she was okay and giving her the time after we had the epi shot just to make sure that she could catch her breath. And Dr. Noah Bernhardson came back in several times to check on her and see how she was doing and ask me how I was doing, which was nice too, because when you're really focusing on your kid, you kind of forget about yourself too. That minute that we were just sitting there so that they could clear the triage room, I did glance at the clock, and then I glanced at the clock again when they got the epi shot in her arm, and that's when I realized it had only been 16 minutes from the time we walked in the front door to the time they got that shot in her arm. But in those 16 minutes, so much had happened. We had gone from the waiting room to the triage room to the room to having the nurses and the doctor come in and assess her and figure out what needed to be done, get an IV in her arm, get a shot in her arm. A lot happened in those 16 minutes. The part that was just so hard is, when we first walked in, it wasn't as apparent, but when we were walking out and you can see so many patients waiting for care, I think it's just also a good reminder for us that the community really relies on Bryan to get that patient care. There wouldn't be that many patients just waiting to be seen if they didn't trust Bryan. The ED crew, they do so much for the community, and I don't think that you could provide the high level of patient care that they do if they didn't work so well together. I just hope that they understand that we value them so much, and I will be forever thankful for that team.